Good afternoon, everyone, and happy International Women's Day for a couple of days ago. We're very happy to have you here today. As Mary explained, we're going to talk about menopause and heart health. And let me just get the slides going. Yeah, so we'll talk about heart health and menopause, perimenopause, go through some definitions, the roles of hormones, the very important roles of hormones in maintaining our cardiovascular health, and how menopause can affect our heart health. And also we'll touch on how we can maintain our cardiovascular health after the menopause. And as usual, after the presentation, we'll leave time for Q&A, some of which have been sent to us already, and some, please feel free to unmute yourself, put your hand up, or just put it in the chat box. Cardiovascular disease is a general term used it's used for all diseases of the heart and circulation. It includes both those that we're born with, they're inherited diseases, and those that develop later on in life. And it includes coronary heart disease, atrial fibrillation, heart failure, which is to do with the muscle of the heart, stroke, and vascular dementia. They all come under the umbrella of cardiovascular disease. Coronary heart disease, which is the most common type of heart and circulatory diseases, is basically globally one of the leading causes of death. In the UK, it is the most common cause of premature death. That's death before the age of 75, and it kills 1 in 14 women. In fact, it kills twice as many women as breast cancer does. And I put this here because, of course, breast cancer provokes a lot of anxiety in all women, but cardiovascular heart disease, coronary heart disease, in fact, kills more women than breast cancer does. And of course, there are many different causes for heart disease, including some genetic predispositions, gender. So up until the age of menopause, men are more likely to suffer from heart disease, but after the menopause, with the fall in the vital hormones, that difference is sort of dies down. And of course, some lifestyle choices like smoking, excessive alcohol, diet, which we'll touch on a little bit later, the aging process, and other diseases like diabetes can affect the incidence of heart disease. I've put these sort of pictures there to explain what happens inside a blood vessel when a plaque is formed. Plaque is also called atheroma, and it's a fatty material that is built up inside the arteries. So if you see the top, this is the inside the vessel, inside a healthy artery, and the flash is showing the blood flow, which is very comfortable and is flowing. The plaque built up, as it builds up on the wall of the vessel, it of course impacts the flow of the blood, and eventually it blocks the artery. This actual plaque consists of different materials. It includes cholesterol, some waste products from the cells, calcium, and a protein called fibrin, which is insoluble. And this causes the plaque formation, or the atheroma formation causes the wall of the vessel to become thickened and stiff, which eventually can lead to heart attack or stroke. There are different risk factors for atherosclerosis or formation of this plaque, from high cholesterol and triglyceride level. And cholesterol, of course, there's different types of cholesterol. And if you have ever had a blood test to check your cholesterol, you'll see on the blood form that, or the blood result, that there's HDL, which is the good cholesterol that protects your heart, and LDL, which is mainly in the processed food that can clog up the arteries with formation and help with the formation of the atheroma. High blood pressure is another risk factor for formation of atheroma. Smoking, type 1 diabetes, obesity or high body mass index above 30, physical inactivity, and high saturated fat diet. All can cause atherosclerosis. So why are we talking about heart disease in the context of menopause? And that is because of the important role estrogen plays in our heart health. It does this both directly by protecting arteries, by reducing the buildup of plaque. It also keeps the level of LDL, which is the bad cholesterol that can clog up the arteries, under control. It also estrogen indirectly helps the heart health by making sure that blood pressure remains low, and it also helps reduce risk of diabetes and other sort of conditions that can contribute to heart disease. Palpitations or rapid heartbeat is quite a common symptom that women often complain about during perimenopause and menopause. It can be, we don't know exactly the reason why this happens. It can happen during a hot flush, and it can happen in isolation. It can be related to the changes to the hormone levels, fluctuations that happens at perimenopause with estrogen, progesterone, and testosterone. It's usually harmless, but of course, invariably it causes a lot of anxiety, and it can wake a woman up in the middle of the night. It can be related to how they feel psychologically. So you can experience palpitations in the context of a anxiety attack or panic attack, or it can be experienced as in the context of a hot flush, or completely as in isolation. Usually with anything to do with heart, it's worth checking it out and to make sure that there's nothing else going on. And I often encourage women to, if they haven't yet discussed it with their GP, to do so, and to get at least an ECG to make sure that nothing else is going on. But usually in most cases, it's okay. The average age of menopause, we know in the UK, is 51, but of course menopause can happen at an earlier stage than 51, and premature menopause is under the age of 40. And there's the reason why I like to talk about premature menopause when we talk about heart health is that it has risk factors for heart disease and other chronic diseases with it, because the protective property of estrogen has basically gone earlier on in life, and so that woman that goes through premature menopause is at high risk of developing heart and circulatory diseases like heart attacks, dementia. Of course, they're at high risk of developing osteoporosis because of the protective benefits of estrogen, progesterone, testosterone may no longer be there. And autoimmune diseases like Hashimoto's thyroiditis, which is an inflammatory thyroid disorder that can be kick-started by the fluctuations of hormones at perimenopause. And inflammatory disorders like Crohn's disease and vasculitis can also be higher in someone going through premature menopause. So the role of HRT in our heart health. Menopause symptoms can result in higher risk of heart disease. We talked about the fall in the actual direct effect of estrogen in keeping our heart healthy, but also other symptoms of menopause can result in higher risk of heart disease. For example, if your physical activity has been reduced because of joint aches, that are very common symptoms of menopause, or if you're very tired, lacking in energy, lack motivation, and therefore you've reduced your sort of routine of going to the gym or walking or just being physically active, that can also contribute to an increased risk of heart disease. Overeating or eating the wrong kind of carbohydrates, which can be sort of happen if you to compensate for your poor sleep, high cortisol level, and poor mood, again can put you at higher risk of developing obesity, which invariably will push on with the heart disease. This is on the right-hand side in the pink box. It's one of a couple of posts ago in our Instagram, and I really like it, and I'm going to read it out again. You may have seen it on our Instagram post, but it goes like this: that as you get older, you realize that your diet isn't just what you eat, it's what you read, what you follow, and who you spend time with. So if your goal is to be healthier in your mind, you have to start by removing all the junk from your diet. And I go over this quite a lot in every talk that I give in menopause, because I think it's a really good time in life to just press the reset button and to have a look at not only what we're eating, the level of activity we have, but generally in who's around us and what we do in order to keep our cortisol level, which is the stress hormone, at bay. It's a really important part of menopause care. You know, hormone replacement therapy, or HRT, is it's only one aspect of menopause, perimenopause care, and it really goes beyond that when you're looking at your whole journey through this transitional time in life. And it's to keep the cortisol level, which is the stress hormone, low. It really helps with metabolism, with weight control, with even sort of incidence of chronic diseases like heart disease. There is plenty of evidence significant evidence really, to say that HRT started at the optimal time. The optimal time is really when the woman's hormones are starting to fluctuate quite extensively, and the estrogen, you know, is starting to reduce at perimenopause. That you really need to step in, check the hormone levels, and begin to replace the hormones. And there's this evidence shows that, you know, once a woman has had that hormone replacement therapy at that optimal time, that helps to protect her heart health, in addition to other diseases like osteoporosis and dementia. So we know that menopause, both directly by the reduction in the protective hormones of estrogen, as well as you know, by emergence of symptoms like joint pain that can reduce physical activity, can negatively impact our heart health. And to maintain and improve that, these are like some of the main points. Exercise is huge in maintaining heart health, in maintaining your mental health as well. The recommendation is 150 minutes every week of moderate activity. That's roughly about 30 minutes a day for 5 days a week. And maintaining optimal weight, which is, you know, roughly it's the BMI of between 20 to 25, and it's calculated, the BMI or body mass index is calculated by dividing your weight in kilogram by your height in meters squared. Mediterranean diet, which is high in omega-3 and 6 and low in saturated fat, of course, helps the heart health, reducing stress, as I spoke about in the last slide, reducing cortisol level. For those who smoke, to give up smoking and to reduce the number of alcoholic beverages, and to consider HRT. As we know, estrogen, there's evidence to prove that it protects the heart. Now, these are the same, the advice here on this slide is very similar to the advice to reduce the risk of even incidence of breast cancer. So in, you know, for women who are very concerned or anxious about taking HRT in order not to increase their risk of breast cancer, we know that, you know, having a high BMI, drinking 2 or more alcoholic beverages every day, or being a current smoker, increases the risk of breast cancer by far more than if you were taking HRT, the correct type of HRT, and for the correct reasons. Now, I left it deliberately as a short presentation just to go over some of the basics of heart health and menopause, because I want to go over all the lovely questions.
I'm busy.
Oh, Is okay. Just to
Find the volume should be working.
hi, can you just mute yourselves unless you want to ask questions? I would be delighted to answer. But I think it's you've asked, you've sent us many good questions that we.
What do I need to do now?
And I'm joined by Sarah, who's the menopause nurse. I'm delighted to have her here. If you have, we've left this slide just so that to make you aware that you can book free 15-minute video calls with Sarah, Kate, or Mary can answer your questions and take you through the journey at OMC and see if this is a suitable solution for you or not. So I think we've reached the last slide on the question. So Mary, if you can just stop recording and I'll stop sharing.